Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Corpus luteum degeneration. Whenever there is decreased luteinizing hormone will degenerate the corpus luteum. When corpus luteum is degenerated, there is decreased progesterone, decreased estrogen, and decreased inhibin A. Decreased progesterone will support the whenever there is decreased progesterone, support to the endometrium is lost. That is, endometrium will shed as menstruation. That means uterine endometrium has two layers, superficial layer and the deep layer. Superficial layer will shed at the time of menstruation. Deep layer is zona basalis. So here in whenever there is decreased progesterone, the support to the endometrium is lost, and as a result endometrium will shed as menstruation. Then decreased progesterone will cause vasoconstriction. This vasoconstriction will release the PGF2, that is prostaglandin F2 alpha, which increases the myometrial contractions, causing pain during menstruation or dysmenorrhea. Corpus luteum degeneration also decreases estrogen and decreases inhibin A. Decrease in estrogen and decrease in inhibin A, both these will increase the follicle stimulating hormone as negative feedback is gone. So this increased follicle stimulating hormone will act on the granulosa cells, and thus it releases estrogen, leading to and also it proliferates the deep layer of endometrium. Now this deep layer of endometrium is responsible for regeneration of entire endometrium in the next cycle. In the second half of menstrual cycle is luteal phase or secretory phase, where the corpus luteum starts to degenerate.
thank you and thank you for watching.